want to talk to you, Professor Sridhar, because back in January, you were concerned about preparations, and it is at that time that we are concerned now that the government didn't get prepared quickly enough. At the time, what did you think the government should have done, and what have they failed to do?
I think the two key things is they first didn't put in place the steps like testing capacity, tracing capacity to contain the virus. And we're seeing that we're paying a heavy price for that. We have 16,000 deaths, just in hospitals in the UK. We're on track for 40,000 deaths just in the first wave. Compare that to New Zealand, which has 16 deaths, and Australia, which has less than 100.
So when you heard yesterday the Deputy Chief Medical Officer say that our containment phase was successful in the briefing, what was your response?
I find it incredibly frustrating because that's not accurate. I think we should just say, and government should just say, there was a mistake made and that we underestimated this virus and that actually we should have put a heavier emphasis on containment. I just feel like there's a lot of people are very defensive instead of just actually coming forward and saying, actually, we'd better be in a position if numbers were lower than right now, where we have hundreds of thousands of cases potentially, and we are trying to exit a lockdown without actually having any clear idea of the magnitude of the problem. The cases will just start rising if we lift lockdown without actually implementing public health measures.
And you say that testing was absolutely key in the early stages. It remains absolutely key. How close do you think we're going to come to the government's own target of 100,000 tests daily, bearing in mind that testing has been important all the way along, but is really important when it comes to easing the lockdown?
Exactly. So I think that we're very far off. I mean, I think it's going to take weeks to get to 100,000. And unfortunately, we're going to need much more. If we take the WHO recommendation, which other countries like Germany have accepted, that's 100 tests for each positive confirmed case. Just going off yesterday, we need 500,000 tests a day. And we're really far off that. And I think, we're going to pay the price of not investing in that for weeks and weeks.
OK, let's bring in Dr. Rachel Clarke. Rachel, I watched you on Question Time and you were extremely powerful, particularly when you were holding the government's feet to the fire. I want to play you a clip from Jenny Harris. She's the Deputy Chief Medical Officer, in which she claimed that we've been an example to the world about how magnificent our preparation has been for all this. Do we have the clip?
The UK, regardless of the position that we may be in now or commentary, has been an international exemplar in preparedness. We had a containment phase and it was very successful. If you remember, we had planes coming in from Wuhan. We quarantined people under very strict quarantine regimes from high-risk areas. We followed up individual cases and families.
I mean, I found that absolutely breathtaking. Literally deluded nonsense. I mean, even referencing flights when we know that we're letting in 105,000 people a week into our airports. Matt Hancock said it on this programme last week. 105,000 people without any checks pouring into this country. And there's the Deputy Chief Medical Officer saying that we've been an example to the world when our death rate is, as we've just heard, is heading to be comfortably the worst in Europe and one of the worst in the world. And this double-page spread in the Daily Mail today, I find particularly horrifying. Because the official government number of healthcare workers and care workers who've died is, I think, currently 43. There are 80 people on here, Rachel, who have lost their lives on the front line of this. What is your belief? I mean, you're at the sharp end of this and you're talking to people at the sharp end. What is the reality about how prepared we were and indeed are right now?
Well, when we all heard those words from Jenny Harris yesterday, I know exactly how people reacted because my phone exploded in messages from colleagues, doctors, nurses, responding with absolute incredulity that anyone could pretend this country has been the exemplar. If you just take the last month alone, the official Department of Health, Public Health England advice on PPE has changed 3 times. And the most profound of those has been a massive downgrade in standards of PPE for staff. So we can pretend, as Matt Hancock and Boris Johnson has done, that somehow everything we're doing is based on the best science. But we all know that's not true. The science hasn't changed 3 times in a month. What's happened is the politicians have realised that we just don't have the stock, and so they've downgraded the PPE with which to protect staff accordingly.
Is it, Dr. Rachel Clarke? Is that? I mean, I think that's such an interesting point, because we keep getting told we are basing our policy on following the science. And I think the suspicion is arising now amongst more and more people that actually policy is being based on resources. And if we didn't have the resources, then we're making policy which isn't based on the science.
That is precisely it. That's the essence of it. And I guess for frontline members of staff like me, who are seeing that death toll of my colleagues rising every single day, we feel, OK, there's a pandemic, so we understand that stocks might be limited, but at the very least, the politicians who are sending us into work without the requisite kit, at least they could be honest. At least they could have the decency to be honest about what's really happening instead of dressing it up as the best science. There's one fundamental question for the government here, and it's this: how is it that for over a month our standards of PPE have been lower than the WHO, the World Health Organization? So according to the WHO, every single healthcare professional who is within a metre of patients, whether they have coronavirus or they're suspected of having it, should be wearing a surgical gown. That's not the NHS England advice. It's not the government's advice. And either we have mysterious, special, exemplary British science, or we're not following the best science because we haven't got the resources. And I just think the least we deserve from the government is honesty.
And so, you say that the WHO requirement is that you should be wearing a surgical gown within a metre of a patient or suspected patient with COVID. What are people wearing instead?
Well, instead, the gowns are rightly being preserved for the people who are most at risk. So those are the people in intensive care more than anywhere, because they are exposed to more of the virus particles than anyone else. But all the other frontline workers, and that's not just the NHS, of course, there are 1.5 million care workers who from the outset seem to have been completely forgotten by this government. They should be wearing gowns, but instead we wear skimpy little plastic aprons. Right. So they don't cover your arms, and this bit, your neck and the top of your chest, they're not covered either. And that means you're at increased risk of catching coronavirus, and crucially, you're at increased risk of spreading it to other patients. So we are using a pinny, essentially, a skimpy plastic pinny. And even now, as the government focuses on this problem of gowns, we can't even get the pinnies everywhere they need to be in the country. So what's happening in the community is so much worse than what's happening in hospitals. There are care homes, there are hospices up and down the country who can't even get paper masks and plastic pinnies. They are begging the NHS supply chain for those supplies, sometimes even saying to them, look, if we don't get these paper masks, we're going to have to close down. As a hospice, we're going to have to send our terminally ill patients somewhere else because we can't care for them safely, and they're still not getting the kit.